I mean, I worked with some of you all those years ago when we tried to convince the country and the Congress, we convinced the country, but we didn't convince the Congress, that we needed, for the sake of our country, to move toward and achieve universal health care coverage. Now, I am proud we tried. We may not have succeeded, but we set the groundwork in place so that now people are saying, boy, we wish we had done that back then, because costs have continued to increase. Pressures on the system, on our doctors, our nurses, our health care workers have just been so stressful. I meet nurses every day who tell me they're thinking of quitting the profession they love because they are having to work overtime. They now have 2 nurses covering where 4 or 5 used to cover. They're not being given the support they need, and each one of you could tell me a story like that. So what we need to do is to make a commitment. And I'm proud that everyone running on the Democratic side is committed to universal health care coverage. Now, we were only given 3 minutes, and some of you know I could talk 3 hours or 3 days about health care. But let me just briefly say, number one, I am in favor of universal health care coverage that brings in the 47 million who are uninsured, which is a disgrace in our country to have millions of people who are left out of the system. That begins to guarantee coverage to people who already have insurance. Because let's not kid ourselves, there are a lot of people who think they have insurance except when they need it. I met a woman in Austin, Texas last week who said, I'm a teacher, Senator. I make $38,000, and I have insurance through my employer, but last year I spent $19,000 out of my pocket, half of her income, because she had a pre-existing condition. So we can't get to universal health care coverage unless we end insurance discrimination once and for all. Now, I don't want to wait until I'm president to do that. I'm going to introduce legislation while I'm in the Senate to end insurance discrimination. Guaranteed coverage, no more cherry picking. You cannot eliminate people on the basis of pre-existing conditions because that's what we need insurance for. And, you know, we've now mapped the human genome. We're going to find out we're all susceptible to something. So none of us is going to be insurable if we don't change this system. And I think we need to start now in order to make some sense out of it and get people the coverage they deserve to have. We are also going to make better use of the money we've got in the system. We already spend more money than anybody in the world, and we don't get the best results because we have all these uninsured people and all these underinsured people, and many of you and people just like you all over our country who can't afford your deductibles and your co-pays, so you go without care, and then the problem gets worse. So we're going to improve quality, we're going to control costs, and we're going to, once and for all, have a health care system that is worthy of our country. Now, I know probably better than anybody how hard this will be. Yeah, I know. I've got the scars to show for it, and I've been through it, but that just makes me more determined, but it also makes me understand what we're up against. Because we've got to modernize and reform the way we deliver health care, but we have to change the way we finance health care. And that's going to mean taking money away from people who make out really well right now. So this is going to be a big political battle. What I'm doing in my campaign is talking about health care every chance I get, asking people for your ideas, your suggestions. I was listening to some of the questions that were asked. Great questions, deserve answers. We're going to have to deal with every single one of them. But if we don't have the support to get a bill through the Congress, we can keep talking about universal health care coverage, and the number of the uninsured and the underinsured will keep going up, and we'll keep spending more money, and we won't have very much to show for it. So we don't only need candidates to talk about it, and we don't just need candidates to have a plan. We're all going to have plans. That's not in doubt. We need a movement. We need people to make this the #1 voting issue in the '08 election, to send a message to the Congress and the special interests. We're serious, and we're going to get it done this time.
Well, I was intrigued by a comment you just made. You said that we're going to change the way we finance the system by taking money away from people who are doing well now. Who specifically are you talking about?
Well, let's start with the insurance companies. The insurance companies make money by spending a lot of money and employing a lot of people to try to avoid insuring you, and then if you're insured, to try to avoid paying for the health care you received.
Well, speaking of the way it's financed, when you do come up with your plan this time, is it going to once again include what was the most controversial aspect of your plan last time, which was this employer mandate, a requirement that companies cover their workers? And will it also have an individual mandate, the way people have to buy auto insurance, and the model that we've seen that put forward in Massachusetts and California?
Well, there are only a couple of ways to get to universal coverage. And I'm pleased that a lot of the people on the Democratic side, both running for president and in the Congress, are saying, look, we got to do one of a couple of things. If we're going to build on the employer-based system, no more free riders, no more companies that don't insure everybody and shift their costs onto other companies that do and onto the taxpayer. So every employer is going to have to provide insurance or pay into a pool where that money can be used to help people. And we may have to say, look, it is everybody's responsibility to be insured. You know, sometimes young people come up to me, and I understand this. I vaguely remember being young one time. And they say things like, you know, I'm healthy. I don't need insurance. I'll say, well, do you drive in cars? Hey, have you ever driven a motorcycle? Do you walk across the street and sometimes not look at the light? You have no idea what can happen to you. Insurance is supposed to be available to make sure that when something happens to you, you'll be taken care of. And frankly, it is to protect the rest of us who are taking care of ourselves. We're being responsible. So I've been impressed that on both ends of our country, in Massachusetts and in California, an idea that we first floated back in '93 and '94, which was to say, look, individuals have to be responsible. So if your employer doesn't provide it, and if you're not covered by one of the government-funded programs, then you're going to have to be in the system. Because otherwise, if something does happen to you, you're going to be the responsibility of everybody else. So the so-called individual mandate, it's really the individual responsibility policy. I think that has to be looked at as well. But we also need to look at how we provide an alternative for businesses that are not going to provide health insurance, and their people are not going to have it, and where can they go to get a good policy? Well, we have two really good programs operating right now. Medicare, which takes care of people over 65, has the lowest administrative costs of any insurance program. You know, when you look at how much private insurance charges for administration and overhead and profit, of course, you compare it with Medicare, there's no comparison. Medicare is like 3% compared to anything from 10 to 35 or up. And we have something called the Federal Employees Health Benefit Plan, where people like members of Congress and people who work for the federal government, they can go into this pool. That's what it's called. It's a big sharing arrangement, and they can have a lot of different choices. And then they can pick what kind of insurance policy. And if they're young and they think they only need catastrophic care because that's all they're worried about, they can get that. If they have kids with some kind of problem, they can get coverage for that. So we can look at how we provide a backup, government-sponsored approach to complement the employer system if we stay with the employer system. And the final thing I'd say about that is, you know, one of the things that happened in '93 and '94 is that people thought that, even though this wasn't the case, but we didn't do a good enough job explaining it, and we're going to do a better job this time, people thought, well, they're going to be required to change what they had, and a lot of people like what they have. So we don't want to have people feeling like, oh my goodness, the government's going to come in and they're going to tell me what I have to do and what doctor I have to go to. That was never, ever part of the plan, but some people got worried about that. So building on what we have and having a bridge to make sure everybody's included And at the end of that bridge, having an alternative that is a government-sponsored alternative gives people choice. So that's what I think we have to look at as a framework, because really every plan you're going to hear about has some combination of those elements.